Hello everybody, welcome to my YouTube channel. My name is Iriarte and I'm going to show you now the medial complex, the medial ligamentary complex of the ankle and its ultrasound view. First we will remember the anatomy of the deltoid ligament very briefly. Two layers, a deep layer and a superficial layer. We will start with a deep layer from posterior to anterior, and we will find the posterior tibiotalar ligament and the anterior tibiotalar ligament in blue. And the superficial layer has four components. The most posterior is the superficial component of the posterior tibiotalar ligament. If we continue anteriorly, the tibiocalcaneal ligament, the tibiospring ligament, and the tibionavicular ligament. Remember that the spring ligament is a ligament which crosses from the sustaculum tali to the navicular bone, and the tibiospring ligament inserts in the ligament, in the spring ligament. The spring ligament, also called the plantar calcaneonavicular ligament. Okay, and to finish, a structure very important to check all this. To locate all these areas and on its function, which is the posterior tibialis tendon, which crosses all these structures above. Okay, remember that this has a hand fan shape, and we always need to orientate properly the probe to have a good view of these components. We will start in this posterior colliculus of the tibia, and with this orientation, and we will go anteriorly, twisting the probe, rotating the probe, till we finish on the anterior component, the tibionavicular component, with this orientation. It's very important, this orientation of the probe, to have a good view of the ligaments. Okay, let's go. We will start first of all locating the tarsal tunnel. And to do so, we place the probe in the posterior medial malleolus, oriented towards the calcaneus. And this is the first image we need to notice to locate. This is the medial malleolus. This is the posterior tibialis tendon, very big, with this oval shape. Close to him, we will find the flexor digitorum tendon here. This is the sustaculum tali, and here, dark, is the flexor hallucis longus tendon. Usually, if you have a good view of the posterior tibialis tendon, you should have a worse view, bad view of the flexor hallucis. And if you're not sure, you need to tilt the probe to, with this anisotropy, locate the flexor hallucis longus below the sustaculum tali. Okay, and to finish, just remember that this is the vessels with the artery and veins, tibial posterior artery and veins, and the tibial nerve, which is dividing usually in three branches. Okay, and now we will follow the tibialis posterior tendon, and we will notice that below this tendon a V-shaped bony contour appears deep with a dark structure inside. This is the posterior tibiotalar ligament. We can see here the superficial component and here the deep one. We may say we don't have a good view of this ligament with this orientation. I can see there is something wrong here, and you're right. And we need to get tense to straighten this ligament. And to do so, we ask the patient to perform a dorsiflexion of the ankle. And with the dorsiflexion of the ankle, this is the image we will obtain. As you can see, we can check a fibrillar pattern and the difference between the superficial component and the deep one, and this is the posterior tibialis tendon. As we saw yesterday, usually the deep component has a tiger shape pattern, and maybe you don't notice it very well in this image. And we can use a small trick I'm going to show you. Usually when you perform an ultrasound, if the probe is perpendicular to the structure, so the sound has a perpendicular direction, you usually the tendon of the anisotropic structures are very, very hyperechoic, like the tissue surrounding these structures. To have a better view to differentiate between these anisotropic structures and the surrounding areas, we can use this technique that you can tilt the probe with a generous amount of gel here, and then we obtain an ultrasound beam oblique to this structure. And the structures with less anisotropy will be still hyperechoic, but the structures with good anisotropy will become dark. Okay, and let's see what happens when we tilt the probe with a good amount of gel. You can notice here a better view of the pattern of the ligament with this tiger-like shape inside the posterior tibiotalar ligament, and a better differentiation between the superficial layer and the deep one. Okay. Now we are moving anteriorly, and the next component will be the tibio-calcaneal ligament from the tibia to the sustaculum tali. Remember, this is the superficial component. Here you can see the tibio-calcaneal, because here this is the talus and here the calcaneus appears, and this is the tibio-calcaneal component of the superficial layer. We still are seeing the posterior tibiotalar ligament on depth. This is the posterior tibialis tendon. Again, we can use anisotropy to obtain a better view of this component, the tibio-calcaneal component of the superficial layer. Okay. With this technique, we see this image darker, and the surrounding tissues are hyperechoic. So the contrast, we can enhance the contrast. Sorry. Sorry. Okay. Next component will be the tibio spring ligament. And if we go anterior, always remember to rotate slightly the probe. We can see this image. This is the spring ligament on its short axis below the posterior tibialis tendon. And this fibular pattern between the tibia and the spring ligament is the tibio spring component. Below this component, we usually find the anterior tibiotalar ligament from the deep layer here, but we don't have a good view here. We will see it better in the next video. And remember that usually this component is not always present. Okay. And to finish, the calcaneonavicular ligament, which is the more difficult to see. And if we continue rotating the probe and moving anteriorly from the tibia to till the end of the spring ligament and the beginning of the navicular bone, here you can see the shadow of the navicular bone, we will see this small thin layer, superficial layer, which is the tibionavicular component. Okay, this is the head of the talus, and this is the beginning of the navicular bone. Okay, that's all the 6 components of the deltoid ligament. And now we are going to check the last medial ligament, important medial ligament, which is the plantar calcaneonavicular ligament or spring ligament. To locate this ligament here, I will use the posterior tibialis as a guide, and I start in this position with a good view of the tarsal tunnel, and then I will rotate the probe till I orient this probe in the direction of the sole of the foot, and we will obtain this oblique image of the posterior tibialis. It's enough to follow this tendon distally till it passes between three bones. We will see in an image the calcaneus, the talus, and the navicular bone. And if we follow the tendon with this orientation, we will find this image with the calcaneus, the navicular bone, and the talus here. You still can see the posterior tibialis in this oblique view, and this image with this fibrillar pattern is the superior medial component of the spring ligament here. Remember that this component usually has an articulation with the head of the talus here. So this is a good view of this component, and we can assess its integrity and if everything is okay. And now we are going to check the ultrasound scan. To begin with, we will ask the patient to adopt a proper position. Usually I use a pillow below the leg, and the foot is free, and we achieve in this position a good, with external rotation of the hip, a good view of the medial side and a slight valgus of the ankle, and it's a good position to explore these structures. We use a generous amount of gel because we need to avoid bony contours and to help us with some structures. First of all, we will locate the medial malleolus and the tarsal tunnel. This is the first scan we need to obtain. And we locate the medial malleolus, and we orientate the probe towards the calcaneus. In this position, we will notice the medial malleolus, the posterior tibialis tendon. This is the flexor digitorum tendon here, and here this is the sustaculum tali, flexor hallucis longus, and the vessels, the posterior tibial vessels, and the tibial nerve below, with this division in 2 or more common 3 branches at this level. It depends on the patient. This is the first view we must obtain. Remember that we must perform this scan like a fan shape in order to have a good view of the different components of the deltoid ligament, and we will start in the posterior malleolus and finish in the anterior malleolus. Both two movements are very important to have a good view of the deltoid ligament complex. Okay, we start in the tarsal tunnel, and we start moving the probe anteriorly and tilting the probe, and we will notice here this valley below the posterior tibialis, and this image is the first image we need to obtain. Remember that we will search the first one, the posterior tibiotalar ligament. This is one of the 2 components of the deep layer. Posteriorly, the posterior tibiotalar ligament, and anteriorly, the anterior tibiotalar ligament. Okay, so you can notice a dark structure here with 2 components, a deep one and a superficial one. This superficial one is the most posterior component of the superficial layer, and this is the superficial posterior tibiotalar ligament here. Some authors didn't recognize this fascicle, but others do, so you usually can distinguish between these 2 components. If we want a good view of the posterior tibiotalar ligament, we ask the patient to dorsiflex the ankle, and we obtain a tense ligament with this fibrillar pattern here. Very, very good image. And again, we can notice these 2 components, the superficial posterior tibiotalar ligament and the deep posterior tibiotalar ligament here. Okay, if you remember, we told you that this ligament has usually a tiger-like pattern, and if we use a good amount of gel and we slightly get the probe with this amount of gel here, we use this technique, we can see the anisotropy of this tendon, of this ligament, and we can see all these fascicles more dark and other more hyperechoic. This is very characteristic of this ligament here, okay? And the superficial component. This is the posterior tibialis flexor digitorum. This is the talus, and this is the tibia. Okay, so this is the pattern, the characteristic pattern of the posterior tibiotalar ligament. If we continue anteriorly and we check the superficial layer, we should see how this layer jumps over the talus and reaches a bone which will appear here. Okay, let's go. And here. This is the calcaneus. So this is the tibio-calcaneal component. You can see here these fibers. And on depth, this is still the posterior tibiotalar ligament. Okay, but you can see the tibio-calcaneal ligament in the superficial layer here. As we go anterior, we still are in the tibio-calcaneal ligament here. This is still the tibio-calcaneal ligament. Remember, this is the sustaculum tali on its short axis. Remember that ahead the sustaculum tali, we will notice the spring ligament just here. And as we go anterior, some fibers go from the tibia to this area here. This is the spring ligament on its short axis here. And this is the tibio-spring ligament. There's no more a bony insertion of the ligament, but a ligamentous insertion of this ligament. This is the spring, this is the posterior tibialis above the spring ligament. And at this level, we should be, if we take a look in the deep layer, at this level below the tibio-spring ligament, we should be at the level location of the anterior tibiotalar ligament in the deep layer. But sometimes this component is difficult to see, and sometimes it's not present. Some authors say 50% of the patients doesn't have this ligament. In this case, this is the image of the anterior tibiotalar ligament here. This is the tibio spring. Always check below the tibia spring. And if we continue anterior, always rotating the probe, here we'll notice the head of the talus. This is still the spring ligament. And now here, this shadow corresponds to the navicular bone, which appears here. And the fibers between the tibia and the navicular bone, this superficial fibers here are the tibio-navicular component of the spring ligament. You can see here. Okay, and these are the 6 components of the deltoid ligament. Now we will check the spring ligament. To do so, I recommend this technique. It's the most useful for me. I start again at the posterior tibialis tendon, but now I change the orientation of the probe following the direction of the sole of the foot, always without losing the posterior tibialis tendon. We will follow this tendon with this oblique axis till it passes between 3 bones. We follow distally, and here there are 3 bones. This is the calcaneus, this is the head of the talus, and this is the navicular bone. And you can see below the posterior tibialis the spring ligament. More concretely, its superior medial component here. And you can see how it has a close relationship with the posterior tibialis tendon, and this joint between this component and the head of the talus. Okay, that was all. No more and no less. That was all the components of the medial complex, ligamentary complex of the ankle. I hope you find it useful in your daily practice, and if you have some questions, please just comment your concerns. I will try to answer all your questions if I can. Thank you very much. And remember, if you like the videos, check the like. And don't forget to subscribe if you want to be informed about new videos.